I am honored and humbled to introduce you to this next panel of trailblazing women who are leveraging cloud technology to advance global health equity. And health equity means everyone has access to health. Everyone deserves the right to have health. And so I hope that you are inspired and motivated to make that change. So today, not only listen for content, but also I challenge each one of you to think about and listen to one bit of wisdom that one of these women has to share with you and understand how that might take you home and make you challenge and use it as a springboard. So today I'd like to introduce my panel. We have Nasha Fitter, Invitae Global Head of Data Platform. We have Sharon Terry, CEO of the Genetic Alliance. We have Cassie Choi, founder of Pear Team. We have Dr. Gabrielle Serafini, co-founder and CEO of WellTel. And then we have Alexandra Berk King, Medical Affairs Director, Digital Health and Data Platforms. So welcome, ladies. So if you could, I've just said your name, but if you could just share a little bit about your background, the work that you're doing, and what inspired you to be in the space of health technology. I'll start with you.
Okay, is this on? Is that on? Okay.
There you go.
Okay, so my name is Nasha, and when my daughter was 7 months old, she started having seizures. And when she was 9 months old, she got diagnosed with a condition, a neurodevelopmental condition called FOXG1 syndrome. And it was bad enough getting that diagnosis, but then I found out at the time there was only 300 other kids that were known in the world with that condition, and that no pharma company really gave a shit to create a drug for 300 kids. So from that, I embarked on a journey of how do you create communities. And I was pretty inspired by hearing all about Web 3.0, which I didn't know was a thing till today, of communities coming together. And that's actually what's happening in healthcare. This top-down approach from big pharma is really getting broken with the advent of genetic testing. And you're seeing small groups of people, advocates, be able to raise money. And thanks to all the exciting technologies coming down, like gene therapies, base editing, we're actually able to create cures for small groups of people. And so just to let you know, 1 in 20 people in their life will get a rare disease. So look around, 1 in 20 of you is going to get hit if you aren't already. And when that happens, there's only, for rare diseases, only 5% have any treatments. So all the work that advocates are doing today is really important. And so for me, my whole life now is really advocating for rare diseases, taking advantage of all the amazing things that are happening. I mean, we're really at the precipice of human history in terms of completely curing all diseases, hereditary diseases especially. So that's a long introduction, but that's the space I live in now.
Thank you.
Thanks. My name is Sharon Terry, and I'm the president and CEO of Genetic Alliance, which is a coalition of about 2,000 advocacy organizations. We are a 36-year-old organization. I came to it only about 25 years ago when my kids were diagnosed with a rare genetic disorder in 1994, before the internet even. And I decided to, as a mom with a master's in religious studies, to grab the bull by the horn. And as my kids in those days said, why do we have ovaries next to the ice cream? We created our own biobank registry. We put together a research consortium. We discovered the gene at night in a lab at Harvard that someone gave us space for. And essentially I've brought all of that and more to Genetic Alliance so that we could actually revolutionize the world of biomedical research from the ground up.
Hi everyone, my name is Cassie Choi. I'm a registered nurse and the co-founder and chief operating officer of Pear Team. Pear Team is a tech-enabled care team that connects low-income, underserved, and marginalized communities with high-quality care by partnering our care teams with community health centers and safety net primary care clinics. So our care teams consist of community health workers, care coordinators, nurses, social workers, and nurse practitioners. And we reduce barriers to care by coordinating services such as transportation, housing, and food access. And then we also reduce access barriers by providing telemedicine visits with our physicians, nurse practitioners, and mental health providers.
Hello, I'm Gabby Serafini, and I am a trained chiropractor, and I have had a professional career of working with many marginalized communities in several different countries. I started my training working with Indigenous communities in Canada, and today I am co-founder and CEO of WellTel Health. WellTel is a digital health communication platform that connects patients or people in the community to their known healthcare providers. We do this by enrolling them into our system using their mobile phone number, and we leverage the use of two-way SMS to build that connection. The reason we do that is because SMS is actually still the most widely used data transfer service in the world. 24 billion text messages are sent every day, and every person in the world that has a mobile phone can access SMS. So our focus as a company has been leading the evidence around digital health technologies. So we were the first program in the world to use health text messaging with patients. We were the first to produce evidence. So that evidence was actually, the first randomized controlled trial was led by my life partner husband, who's here today, Dr. Richard Luster. And he actually created this incredible platform within the research realm and needed somebody with a cape to come in and take it to the next level. So that's how I got involved. And what inspires me is really believing that everybody deserves equitable access to healthcare. So we focus on health and language equity in our company. Our vision is to leave no person behind. And in terms of being part of this panel and how incredibly humbled and honored I am, the first email that I got from Danielle I thought was spam because it was inviting me to come to the UN, and I said, oh, delete, that's spam. And then I got a second one. And so this is just, I'm so touched and honored to see that the world is finally paying attention to equity, because we all need to be so much more conscious about how we do business. And I think that we have to be inclusive. And this is a women's conference, but if men are not part of the conversation, then we're not going to get to where we need to be. So thank you.
And I'm Alexa Berk. I'm a health researcher, behavioral scientist, professor, and author in the health outcomes space. I've had the privilege of being involved in health research for close to 20 years now. I've seen it from the academia side. I started my career at Memorial Sloan Kettering Cancer Center. I've seen it from the pharma industry side. I spent some time at Novartis as well in the oncology clinical trial space. Now I have the privilege of serving as a medical director for the digital health and data offerings at Invitae. Invitae is a leading genetic testing company that's really based around the principle of empowering individuals with knowledge of their genetics that they can use to make health decisions for themselves and their family. It's an area which has previously been not accessible to many folks. And so we really believe in democratizing access to top quality medical care, access to knowledge and information about yourself and your genetic risks for various diseases, ranging from cancer, cardiology, neurology, rare disease, et cetera, and really beginning to put patients truly at the center of advocating for themselves and their families in their health journey. So it's a privilege to speak with you all today, and look forward to talking more about how we can increase more equitable treatment of patients throughout the research ecosystem as well as the healthcare systems in general.
So, Alexa, I'd actually like to start with you
Sure.
on that note. Over the course of your career, you've led a number of global research trials, and you advocate actively for inclusive clinical trials and research. I want to understand, oftentimes we're asking women and people of color to do the work to create those spaces. But I want to ask you, what role does the industry have to create those spaces for diverse voices?
Sure. This is a great question, and it's a timely question. Speaking of the power of naming a day for something, today is actually World Clinical Trials Day, too. It was named after widely considered to be the first clinical trial that James Lind performed in 1747 with sailors who had scurvy and separating them into control groups. I would argue that there are probably African and Middle Eastern peoples who've been doing clinical trials wide before then, but James Lind, the British researcher, is who we acknowledge. But really that speaks to me about sort of the history of who has been at the center of the conversation about clinical trials and clinical research. And unfortunately, there's been a large power disparity in who gets to decide what conditions are being studied, how we're conditioning them, how we're running the trials. And unfortunately, women and people of color have largely been left out of that conversation. The FDA has long recognized this as a problem. The National Institute of Health has long recognized this as a problem. Industries recognize this as a problem. We've been talking about it for decades, and it's not changing. The numbers aren't improving. And there's real consequences to this. So you see something like prostate cancer. It impacts black men at a rate of 75%, higher incidence that it impacts white men. Who are in the clinical trials? The white men. So what does that mean? It means a couple things. It means where the clinical trials are slow to complete, patients are waiting on drugs, and they're taking years to complete because they're not reaching a broad community and folks aren't enrolling. It also means the drugs that are being developed on the genetic profile and pharmacogenomic profile of a certain population that's not the population that's ultimately going to receive the drug. A key issue of this is warfarin. It's a very common blood thinner. Again, clinical trial for it was mainly done on white men in the 1950s. In 2013, we realized that Asian Americans, because of their genetic profile, need much lower doses. Asian Americans were dying, having bleeding events because they were receiving doses that were designed for a different population. Had they just been included in the clinical trial where the dosing is actually defined and approved by the FDA, we could have tailored it to different groups. So unfortunately, there's actual real deadly consequences of underrepresentation in clinical trials. Some folks recognize this, and there's been some efforts to make clinical trials more accessible, translate informed consent forms into different languages, meet people where they're at with recruitment. But I would argue there's something much more important that needs to happen to improve diversity in clinical trials, and that is the research industry, myself and my colleagues included, addressing the historical abuse of women and people of color by the medical industry and by the research industry specifically. We've done interviews, for example, with black women with breast cancer about why they're not signing up for clinical trials. They're scared. They don't want to be treated like guinea pigs. And unfortunately, I think the COVID situation has revealed this even more deeply, right? Folks are very distrustful, often with good reason, of the research enterprise specifically. So I think we as scientists and drug developers and doctors and researchers need to really step up, acknowledge what's gone wrong in the past, be open, and work to rebuild that trust, because the trust just isn't there right now.
Thank you. Does anyone else have any thoughts about that?
Okay. A lot to say.
Sounds good. Okay. Nasha, I actually want to kind of direct my next question to you. Over the last 20 years or so, there has been a recognition that people living with rare diseases are not getting the attention that they need in clinical trials, in the development of new drug therapies. What opportunities are there with the use of technology? Do these communities who are often underserved and underrepresented have to advocate for their own health and well-being?
Well, one thing is, I think, just the general trend towards precision medicine, where, if you have a condition and you haven't gotten a full genome sequencing done, I would highly recommend it, so you could figure out if any of that is related to something genetic. As more and more people do this, we create more drugs that are targeted towards the actual symptom, and also, like Alexa mentioned, the pharmacogenomic profile of each individual. We're going to have more tailored therapies, and by doing so, it kind of breaks down the way drug development is currently done, where it's so expensive, and it's, just the way trials are done. We're already seeing data being used as a placebo arm, for example, which lowers the cost pretty massively. And also, who wants to be the placebo arm in a trial, right? So why not just use like the natural history data set as a placebo arm? So we're starting to see a lot of really interesting trends in healthcare that are going to just bring down the cost of development of therapies, as well as making therapies more precise, which obviously then helps rare diseases, et cetera. But I also think, the biggest problem with rare diseases is funding, and I think someone was mentioning it, and I know you're, a big infectious disease proponent, but for hereditary diseases, there's just not a lot of funding that goes into it. Really, it's AIDS gets a lot of funding, mainstream cancers get a lot of funding, and everything else is kind of just secondary. So a big part of it is funding, and I always tell people, again, 1 in 20 people will get a rare disease. So as you think about your philanthropic portfolio, make sure a percentage of that is just going to a rare disease. Just pick one. I mean, you've got to know someone who has one, right? Like, just pick their foundation and give them some money. And unfortunately, for rare diseases, a lot of initial work has to be done in the philanthropic realm of, and Sharon's gone through this, building your mouse models. Guess what? Like, nobody wants to fund your mouse model. That's not sexy, but you need to raise money to do that work, to even have something to take forward to get for-profit investment.
Thank you. And with that, I kind of want to build on what you're saying and direct this question to you, Sharon. Your journey, as you mentioned a little bit earlier, has been a personal one, not just because of your achievements, but because of the diagnosis of your children, but because you believe that high tech, high touch should be grounded in personal. Can you say a little bit more about that, please?
Yeah, this is a really terrific place to say this, because I think we've heard this all day, actually, that technology can solve a lot. And we still need to have really high touch. Relationships are going to be very important. I believe that women are very good at relationships many times, and so that's really where I put a lot of my energy as well. To build on what Nasha said, it is true that there are 7,000 rare diseases and very few of them have therapies. But I think there's systematic ways now to do long-tail crowdsourcing that we've seen in things as early as when Amazon's got started, and I realized I could get that esoteric book out of someone's attic. It's the exact same thing we need to do here. And so my quest essentially has been to say, how do communities from the ground up revolutionize these systems that so far we've been reliant on physicians for? And in my personal journey, that certainly meant, like I said, doing things that nobody else was doing and finding ways to do them. But now we have a lot of access in the sense of a World Wide Web, and Web 3 will be great. We have Amazon Web Services allowing cloud storage of things that we had to store on hard drives and so on. A project that I'm just undertaking that really has enormous effect on health equity is that I've been given a wonderful donation of cloud storage from Amazon Web Services. I have been given $120 million in sequencers and reagents to sequence undiagnosed kids all over the globe. And as Nasha also eloquently said, there is no philanthropic ecosystem in inherited disease. And so we're looking at ways to systemically raise the water for all diseases, so we don't have to just give money to individual diseases, but instead to coalitions, to alliances, certainly to mine, geneticalliance.org, and to allow actually these great technologies, great resources to be distributed all over the globe for much less than if we tried one disease at a time. And so the kind of personal piece for me in this is, how do we do that and retain our own integrity, our own sense of self as we move through that? And really working hard to say, where is it that I'm afraid, and how do I move into that fear, toward that fear, be with that fear? I also like to ask, what is it I'm waiting for, and what would happen if I stopped waiting? And I think that's going to be true for all of us as we push into new frontiers.
Yeah, and I'll just add to that. The reason I spent $3,000 to meet with those NFT guys, who I actually don't even know who they are, is we're trying to kick off the ground with a bunch of other rare disease orgs to create these NFTs. So for example, my daughter has FOXG1 syndrome, so Frankie the Fox is our mascot, very cute little fox, you can see on our website. So we've created a whole bunch of different artwork around it, and we're now working with a group of people who have been doing NFTs for a while to create an ecosystem for rare diseases. It's just a way to raise money for science. So I think would love to talk to anyone if they have more ideas, but I think there's ways we can also just make it cool and fun, and most people want to get involved in interesting ways and do kind of cool things around it, and these are really spectacular children that we can help, so I think that's another way to find ways to kind of create this philanthropic ecosystem that you mentioned.
Thank you. Cassie, I want to go to you next. You started your career as a nurse, treating underserved people. You were often told that you were not going to be that bedside nurse for long, so you leveraged your entrepreneurial spirit to solve problems at scale. What are some of the skills that you developed in doing so to go from nursing to entrepreneur?
Oh yeah, I didn't even know that entrepreneurship was a thing when I was a nurse, so it's been quite the journey. When I was in nursing school, I had the amazing opportunity to do a lot of experiential learning very early. So I worked in a community outreach van in low-income communities in Boston, doing health risk assessments and enrolling my neighbors into insurance plans that they didn't know they were eligible for. And I worked in homeless shelters, administering vaccines to houseless individuals. I also worked full-time in the emergency room to put myself through school, providing care to people who didn't know where else to access care for themselves and for their children. So very early on, I started to see where people could or could not find care for themselves. So after working as a critical care nurse for a while and trying to make changes from within the system, I got really frustrated very fast. I could not make the changes I really wanted fast enough. I saw big problems and I wanted big changes. But honestly, health inequity is a big, hairy, systemic problem. I mean, racism, capitalism, politics, even just access to a cell phone or access to the internet creates a lot of problems. And so there's no silver bullet for it. But for me, I wasn't gonna shy away from being a part of the solution. I'm just one of those people, if I see a problem, I have to fix it. And as a woman, and particularly as a daughter of an immigrant, I have been othered, but I've also never had to question where I would receive care. And I've also had the amazing opportunity to receive an amazing education. So I was definitely gonna put that to work. So in nursing school, I learned how to assess a patient and create a care plan and implement it, how to develop therapeutic relationships with patients and communicate with them and their patients. And like you said, my nursing professor called it out. She's like, you're not gonna be a bedside nurse for long. I was really offended when she said that because I was like, I'm spending a lot of money in nursing school. I don't know what you're saying to me right now. But when I got really frustrated, I was like, oh, this is what she means. I quit. I actually quit without a plan. But I put those skills to work. So I assessed the market and I assessed the problem and I created, instead of a care plan, I created a product solution. And I implemented it with customers. And instead of building relationships with my patients, my team does that now. I was building relationships with investors and customers. And I communicate now with my team and with the community, with all of you, about our mission all the time. But I don't know everything. And in order to get here and moving on, I have to learn things all the time. And I take stock of what I don't know all the time. And I have to seek mentorship from advisors and mentors just to learn all the things that I don't know, which is a lot. So I'm always trying to learn how to navigate a very complex healthcare system, how to navigate the ins and outs of startups and business, like fundraising and balance sheets. I'm a nurse. Balance sheets are like a whole new world for me. But most importantly for me, I'm always learning how to be a better leader. That's not something that is taught, especially to women, in school. So I'm always seeking mentors to teach me how to be the leader that my team needs me to be, so that Pair Team can be the vehicle for change that I know it can be. And what I've learned, especially, is that women have to be in the room in order to solve the big problems ahead of us in the world, especially health equity. That's the one that matters to me the most. We've talked about this, right? Health equity is so important. If you don't have your health care, if you don't have your health, everything falls to the wayside. Whatever you value, your family, your freedom, it all goes away if you don't have your health. So that's the thing that I fight for. But women are the ones that are going to be to solve that. We have been othered. So we know the impact of not solving this problem for those that have been marginalized. but we're also so capable of being the leaders that can build relationships with the people that will join our missions. We're the ones that can see those people in ways that we have not been traditionally seen, right? We can honor and value the gifts that they bring to the table to solve the problems that we're trying to solve. We can create space for people on our team in ways that they've traditionally not been able to take up space. And so for me, we have an amazing tech platform backing our entire team. And so will that be a part of the solution? Totally. But, you know, part of solving problems is tech, but always it involves people. And I am such a believer that when we face all of these big problems in the world, they will be solved by amazing, motivated, self-aware women. And so I'm so honored to be here amongst these women, amongst all of you, and to be honored by Wendy in an organization that's really supporting bringing more women into entrepreneurship.
Thank you so much. So I want to be able to tap into your wisdom about Dr. Serafini, about your entrepreneurial spirit and how you're leveraging your spirit, but also technology to advance health equity.
That's a new question for me. That wasn't on the agenda. So I'm just letting the wheels turn for a minute. Okay. I think a big part of, I'm gonna also speak a little bit about what Cassie spoke about. I think I'll talk about that first, talk about people. So we have this digital health platform. We allow patients or clients in the community to report in on any health issue of concern. This means that we are collecting their voice. What are the barriers and the facilitators to their health behavior? Where do they have access challenges in the open, natural language of their voice? What this gives us and tells us are new things about social determinants of health, for example, new data sets that do not actually exist anywhere else. And we actually collect it in every single language. So, and this is about meeting people where they're at. So what you spoke to earlier. So now that takes us into human beings, artificial intelligence. So artificial intelligence, sure, it's already giving us a lot of incredible solutions, but it's also being developed mostly by men, and I would get mostly by white men. And if you look at how many women are actually working in the development space of artificial intelligence, you can probably count them on one hand, maybe two. So how are those tools going to affect anyone that isn't in that demographic, which goes to your point about clinical trials and equal representation in the clinical trials. So yes, our tool, we do predictive conversational analytics, but I'll remind you, in multiple languages and natural voice. And this gives us an insight into people's behavior. But what I like to say is that we are AI guided by RI. So we have real intelligence, we have human beings behind the conversations. We're not using chatbots. Not that chatbots aren't good to direct you to the hospital front door, but when you're talking about human beings and their health, it is that relationship, the people relationship, that really matters. Now I'd like to speak a little bit about how we leveraged technology during the pandemic, and in particular AWS. So the reason that I'm here is because I applied to the AWS Health Equity Initiative to improve access for Indigenous communities in Canada and for Maori youth in New Zealand, where we also work. So to add additional features to our tool that would allow for cultural responsiveness, that would make sure, again, that we reach our vision of leaving no person behind. So when the pandemic hit, we do have a strong history in Africa. We started in Kenya. We have strong relationships in Rwanda. We were approached by the Director General of the Rwandan Ministry of Health, who asked us, could we get our platform set up for national scale in Rwanda? Why? Because they had a number of digital platforms that most of their population could not access, because people don't have data, they don't have Wi-Fi, they don't have smartphones. So over a weekend on Zoom, the WellTel team set up on Amazon the digital health platform, which was then used in Rwanda to support patients who were on home isolation for COVID-19. So over 18 million text messages were sent through our platform. And all of these people were successfully triaged into the appropriate care, and not one life was lost. So have I answered the question sufficiently? Okay,
Beautifully.
thank you.
Thank you all so much. I am personally inspired. I've been in the field of public health for 17 years, but I'm constantly amazed by women such as the ones that I have on my panel to want to do more, to be more, to change the world like you all. So thank you so much for the work that you do every day to advocate for people and to meet them where they are. So thank you so much.
Thank you.
Thank you. Thanks, Danielle.